The State Department of Public Health says California is not among the dozens of states seeing an outbreak of cyclosporiasis, that parasitic infection that often spreads from contaminated water or food. But they do want people to take precautions as officials work to identify the source. News 8's Shannon Handy has the details.
For people who have contracted cyclosporiasis, the experience has been described like this.
The cramping, the stomach pain, feels like someone is squeezing your insides.
The illness can cause explosive diarrhea, nausea, abdominal cramping, bloating, and fatigue. Symptoms can last for weeks. People become infected by eating contaminated produce or drinking water tainted with the microscopic parasite.
All the outbreaks that we've seen in the past haven't been related to swimming pools, for example. They're more common with produce that has been contaminated or grown in another country where there's a higher probability that the soil may be contaminated with fecal-infested water.
Dr. Seema Shah is San Diego County's medical director for epidemiology and immunization services. She says there are no known case clusters linked to the current outbreak in California, but health officials are watching the situation closely.
Because we're not seeing this in California doesn't mean that we wouldn't see it.
The CDC says nearly 7,000 confirmed and probable cases have been reported across 34 states, with the highest numbers in the Midwest, specifically Michigan. Investigators have not identified a specific source, but say lettuce is among the items being examined. Health experts stress there's no reason to stop eating fresh produce. Instead, they recommend safe food handling practices.
Washing your hands with soap and water before you're handling any kind of fruits and vegetables. Making sure that you're thoroughly washing your fruits and vegetables under running water. When practical, you may want to cook your vegetables and your herbs.
At least 141 people have been hospitalized, though no deaths have been reported. Young children, older adults, and people with weakened immune systems face the greatest risk of complications.
Only less than 1 in 10 people are actually hospitalized, and typically it's due to dehydration.
Dr. Neil Kumar, co-founder of Concierge MD, says symptoms often don't appear until 1 to 2 weeks after infection. He says anyone who suspects they may have cyclosporiasis should contact a doctor.
See a medical professional. There are antibiotics that can treat it.
Shannon Handy, News 8.